computer, all you need to do is just click continue. So this is the first in a 3-part series on substance abuse and youth. My name is Laura Maloof Miller. I'm a program manager in the wellness department at HealthNet. Kristen Kayla, health promotion consultant with HealthNet, is also on the line. Just a couple of housekeeping items. Everybody who's on the line now has been muted. And of course, that's to avoid any of the background noise. Also, at the end of the webinar, there'll be an anonymous 3-question survey. So we would, of course, appreciate your feedback. And if you have any questions throughout this webinar, please chat to the hosts and the panelists. If we have time at the end, our presenter may be able to answer some of the questions from the chat. It'll just depend on timing. If you need to jump off early, don't worry. Everyone who registered for this webinar will receive a link to the recording in just a few days. Also, in that email, I will include the invitation links to the upcoming webinars, the 2 more in this series. One is on May 14th, talking with your child about substance use. And then on May 23rd is the impact of marijuana vaping on the youth's developing brain. So today, HealthNet is so excited to have partnered with the Los Angeles Public Health Department to bring you this informative webinar. Our presenter is from the Harm Reduction Unit and will guide us as we explore the crucial role of naloxone in emergency situations, equipping you with the knowledge necessary to effectively intervene and potentially save lives. Please keep in mind, this information provided in this presentation is intended solely for the general information of the audience. It's not medical advice and shall not replace consultation with your physician or other qualified health provider. If you happen to have health-related questions or problems, please seek the advice of your physician or other qualified health provider. Now, please welcome our presenter, Lizette Della Trinidad Alvarado. I'm going to stop sharing and let you go ahead and share and introduce yourself.
Perfect. Thanks so much, Laura. Let me go ahead and get my presentation up.
All right.
And then let me know if it's coming across okay.
Yes, it looks great.
Okay, perfect. I just want to make sure you're seeing the main title slide and not any other, notes or anything.
That is correct.
Awesome. Thank you so much, Laura. I'll go ahead and get started because we do have quite a bit to cover. Hello, everyone. My name is Lisette de la Trinidad Alvarado. I'm a health program analyst here with the Los Angeles County Department of Public Health. Today, we're going to be talking about responding to an overdose with naloxone. And by the end of today's training, you're going to be able to identify associated risk factors that could increase the risk of an overdose. We're going to demonstrate how to effectively recognize and respond to an opioid overdose using the life-saving medication naloxone. And then I'm also going to provide you all with some resources for accessing ongoing support and care. To start off today's training, I want to talk a little bit about opioids and really just lay the foundation for what they are, what they're used to treat, the effect they have in the body, provide you all with some examples, and also outline some potential problems that could arise from using an opioid. So opioids are a class of drugs that come from or they mimic the natural substances that's found in the opium poppy plant. And opioids work in our brain to produce a number of effects, one of which is blocking pain signals from reaching the brain. So medically, this is really helpful. We'll see opioids typically prescribed to manage moderate to severe pain, the type of pain someone might experience after surgery or after an injury. And just to provide you with some examples, these are some brand names you might be familiar with, but it includes Vicodin, OxyContin, Percocet, methadone, and fentanyl, which we'll be talking a lot about today. And then some potential problems, which I'm going to go into more depth in the upcoming slides, but they can cause respiratory depression. They result in slowing our breathing rate, which could lead to an oxygen emergency. And I'll talk about that in a little bit. But one thing I want to emphasize is, why am I only talking about opioids today? We very well know that an overdose can be caused by stimulants, they could be caused by depressants, but I'm only talking about opioids today. And the reason for that is because I'm going to be talking about naloxone, which reverses an overdose that was caused by an opioid. Naloxone is not going to be able to reverse an overdose that is caused by a stimulant or is caused by a depressant. But I'm getting a little ahead of myself. I'm going to go into a little bit more detail on that in upcoming slides. I first want to talk about how opioids affect the body. And what opioids do is they bind to and they activate receptors on our cells that are located in many areas of the brain, the spinal cord, other organs in our body, especially those involved in feelings of pain and pleasure. So when opioids attach to these receptors, they block pain signals that are sent from the brain to the body. And then they also release large amounts of dopamine throughout the body. And this release can strongly reinforce the act of taking the drug. This is really contributes to the addictive qualities of opioids. And it really makes that user want to repeat that experience. So really, just to summarize, opioids can relieve pain. They make people feel relaxed, happy, but they can also have some harmful negative side effects. They can cause feelings of drowsiness, confusion, nausea. They could be constipating. And again, they can slow breathing rate. So what's happening during an opioid overdose? Essentially, there's an overwhelming amount of opioids that are occupying receptors in our brain that are responsible for regulating our breathing. That's going to lead to oxygen starvation. If no intervention is made at this point, it will inevitably lead to that person going into a coma. I want you all to keep in mind that 3 to 5 minutes without oxygen, brain damage starts to occur. And again, if no intervention is made at this point, it will lead to death. So when you think of an opioid-related overdose, I want you to think of it as a breathing emergency. So surviving is going to entirely depend on that person's ability to breathe. And I'm a visual learner, so the next slide is really going to provide a representation of what's happening. There's an excessive amount of opioids in the brain. They are all occupying receptors responsible for regulating our breathing. And you could see in the brainstem there, that's when a breathing emergency starts to occur. Just think of it as though when all these opioids sit on these receptors, breathing stops. So what does an opioid overdose look like? Well, I first want to outline the difference between what it looks like if somebody's impaired and what it looks like if somebody is experiencing an overdose. And now, when someone is impaired from an opioid, their muscles are going to be really relaxed. You're going to see that their speech might be a little slow or perhaps a little slurred. And the best way I can describe it is a person looks like they're tired. They looked really fatigued. They look like they're trying to fall asleep. And they might do what we call nodding in and out. And if you've ever been really tired and you've kind of felt yourself like fall into sleep and you jerk your head awake really quick, that's what nodding in and out feels like. Their heart rate is going to be really reduced. And now here is the key indicator that I want you to remember. If somebody is just impaired from an opioid, they are going to be responsive to some type of stimulation. If I shout their name, if I shake their shoulder, if I administer a sternal rub, which we'll talk about in upcoming slides, they're going to respond. They are going to acknowledge that type of stimulation somehow. That's not what we see with an overdose. So again, with an overdose, it is a breathing emergency. We're going to see that their breathing is either infrequent or they're not breathing at all. They might be making this deep snore-like gurgling noise. We refer to it as the death rattle. It's basically somebody trying to take in oxygen, but it's not going into their lungs. Instead, saliva starts pooling in the back of their throat. it sounds like a snore. Their skin might be pale, clammy, there's a loss of consciousness, their heart rate has slowed. And here's the key indicator is that they are unresponsive to stimulation. If I yell their name, if I shake their shoulder, if I administer a sternal rub, they are not responding. And it honestly looks like when somebody is overdosing from an opioid, it looks like that person is asleep. And it's really unfortunate because a lot of overdoses have gone without somebody providing some type of life-saving intervention because people have just dismissed it as that individual being asleep. So it's really important to recognize that an overdose can look like just that, somebody being asleep. And that's why it's really important that we provide some type of intervention. I want to talk a little bit about risk factors. So when I say risk factor, this could be a characteristic, a behavior, something that's associated with a higher likelihood of a negative outcome. And before I get into talking about risk factors, I want to say that anyone who's using an opioid is at risk for overdosing, but there's some additional factors that can put somebody at an even higher risk of overdosing or fatally overdosing. And one is using alone. And while this isn't necessarily a cause of overdosing, it increases the chance of somebody fatally overdosing because there's nobody there to call for help. There's nobody there to administer naloxone. And we're going to learn in upcoming slides that naloxone cannot be administered to yourself. If you're experiencing an overdose, you can't give yourself naloxone. Because remember, when you're experiencing an overdose, you're unconscious, right? You're not responding to anything. So using alone really increases the chance of fatally overdosing, again, because there's nobody there to provide that life-saving intervention. And then there's tolerance. So tolerance occurs because the brain cells that have receptors on them gradually become less responsive to stimulation. So more opioids are needed to produce that same level of pleasure compared to when somebody first started taking a drug. And the thing about tolerance is that it can decrease rapidly if somebody's taking a break from a drug, if it was intentional or not. So let's say that a person was, in drug treatment, if they were in the hospital, if they were in jail, whatever that reason is, this is a really risky time for them because they're coming off of a break. And if they decide to use in the same amount that they had before, they could unintentionally overdose because, again, their tolerance for that drug is significantly lowered. And it only takes a short amount of time for your tolerance to decrease. Another risk factor is drug quality. So when I talk about drug quality, I'm referring to how pure or strong a drug is. Now, the content and purity of a street drug is always unpredictable. You're not going to be able to tell how pure a drug is from looking at it. And when we look at street drugs, we see that these purity levels are always changing. There's always the possibility that it could be laced with something else. In LA County, we're seeing a lot of street drugs being laced with fentanyl. So that leads the risk of somebody using a drug that is a lot stronger than they intended. And again, this could unintentionally lead to somebody overdosing. Another risk factor is using multiple substances at once. So when drugs are taken together, they can interact in ways that really enhance each of their effects, and it can lead the person to stop breathing entirely. This puts a lot of strain on the person's heart, on the person's system, and oftentimes we see that a person that's using multiple substances is pretty common, right? We don't just see somebody misusing opioids. Oftentimes they'll be misusing opioids and drinking, or they'll be misusing opioids and using cannabis, or a number of other, possibilities out there. It tends to happen with other substances at one time, and that could lead to an increased risk for overdose. And then how a person uses. So regardless of how a person uses, if someone uses enough of a drug in a short amount period of time, an overdose is going to be possible. But there are different types of administrations that are going to deliver the drug more quickly to the brain. It's going to be more likely to create a rush. We see that intravenous injection are are riskier than if somebody were to like orally take a pill. And then age and physical health. So if your body is already in a compromised state, let's say you're sick, you're fighting off a current infection, you're malnourished, you're dehydrated, all of these factors are gonna impact your body's ability to manage the drug. So this is also puts an individual on increased risk of an overdose. So really quickly in the next couple of slides, I'm going to be talking about overdoses in LA County, what the current trends are, what that climate looks like right now. And what we're actually seeing is that less people are misusing prescription opioids. There's been a steady decline since 2015. And this is amongst the total population for individuals aged 12 or older. We're seeing a consistent decline in misusing prescription opioids. On the other hand, though, we are seeing overdose deaths continue to rise. And I wanna really pose that question. Well, why is that happening then? If less people are misusing prescription opioids, but more individuals are dying from opioid-related overdoses, how is this happening? And the reason for that is because of fentanyl. And really, when I talk about fentanyl, I like to break it up into two groups. There's licit fentanyl, which is prescribed, used in a hospital medical setting, and then there's illicit fentanyl. So first, I'm going to talk about the fentanyl that's typically used in a medical setting. It is a synthetic opioid. Synthetic meaning it's made in a lab. It is 50 times stronger than heroin and 100 times stronger than morphine. So pharmaceutical fentanyl was developed for pain management. Typically the type of pain management and treatment we would see for cancer patients. And when prescribed by a doctor, fentanyl is typically given as a shot, a patch, that's put on a person's skin, or given as a lozenge that is sucked like a lollipop or a cough drop. And one thing I want to emphasize here is I know we hear a lot of bad things about fentanyl in the media, but in a medical setting, when it's properly used, when it's used correctly by a medical healthcare professional, it's really helpful in treating that severe pain. Again, the type of pain we'd see in advanced cancer pain. Now I'm going to go ahead and switch gears and talk about illicit fentanyl. So this type of fentanyl is diverted for abuse. It's more often associated with overdoses that we see happening currently. And this is the type of fentanyl that is made in clandestine labs. And there's no regulation happening at these facilities. And we see here that it leads to some pretty dangerous characteristics. One is that it's extremely potent. It's really cheap to produce, it's colorless, and it's odorless. And so what this has led to is drug dealers intentionally lacing drugs with fentanyl because it allows them to traffic larger quantities, and it also helps them maintain the effect that drug users have come to expect. And we do see that fentanyl is being identified in a lot of counterfeit pills that are mimicking pharmaceutical drugs like oxycodone. Oh, actually, before I go to the slide right here, I do want to draw your attention to the upper right-hand image. This was an image provided by the Drug Enforcement Administration, and what you're seeing there is 2 milligrams of fentanyl. That is a representation of a lethal dose of fentanyl. And I talked right now about there being increasing amounts of counterfeit substances being laced with fentanyl. This next image also provided is the number of pills containing illicit fentanyl that was seized in the US. This is data, again, provided by the Drug Enforcement Administration. But you could see the increase occurring since 2018 to their most recent data updated was 2021. And to further illustrate that, 7 out of 10 pills with fentanyl contain a potentially lethal dose. And keep in mind that out of all the pills that have been seized by the DEA, 7 out of 10 had a lethal amount of fentanyl. Now, remember I talked about risk factors in a few slides ago. All because the other 3 remaining pills didn't have a lethal dose. If it's combined with people using multiple substances at once, if their tolerance was lowered, if they were not physically well at the time that they were taking the substance, all these are contributing factors that could still lead that person to overdose. So that's something I also like to emphasize and want people to keep in mind. And we don't say this as a for fear-based messaging reasons, but it's just to provide some type of awareness of the prevalence that fentanyl is playing right now in our community. And then right here is a another image that was provided by the DEA, and it is a fake oxycodone tablet. And I want to go ahead and let you all kind of think for a second on being able to tell the difference between which one is fake, the left or right. And oftentimes when I ask this question, I get a mix, right? It's really 50-50 on which is fake. Oftentimes I'll get individuals saying, you know, the right side is fake, it looks too perfect. Or the left side is fake, you know, there looks to be impurities. And really, there is no way to tell. In this case, the right one was fake, the left one is real. And I showed this image just to really emphasize the takeaway of really never trusting with your own eyes to determine if a pill is legitimate or not. The only safe medications are going to be the ones that have been prescribed by a trusted medical professional and that was dispensed by a licensed pharmacy in the US. And the reason I say in the US is because there was a recent article in the LA Times, and it was a study that was done by UCLA, and they reported that 55 pills purchased from 29 pharmacies in 8 cities in Mexico were tested. More than 50% of those pills were determined to be counterfeit. And then more than a third of the 40 opioid pain medications purchased tested positive for illicit fentanyl. So there was cases where even entire bottles appeared to be factory sealed. They had their logo, the labeling on it, and they were actually tainted. And so these pharmacies included locations like Playa del Carmen, Cozumel, Tulum, Tijuana, Cabo, and Puerto Vallarta. And the pills that were purchased included Adderall, Percocet, and oxycodone. So again, unless it was prescribed for you and it was obtained by a US pharmacy, it does run the potential for being laced with something. Another thing I like to emphasize during these trainings, some you know, we're here to share factual information. And what we've been seeing in the media is a lot of stories from first responders, from law enforcement, of instances where, you know, these individuals, first responders, were reporting that they had overdosed from being in a room where fentanyl was present or from touching fentanyl. They experienced, you know, suddenly their heart was racing, they were sweating, and they passed out, or they needed to give themselves Narcan. And there was a study that was actually done to investigate these claims from the American College of Medical Toxicology. And they issued a report saying that they found that an overdose would take 200 minutes of breathing fentanyl at the highest airborne concentrations to even yield a therapeutic dose. But not even that would be a fatal one. So the takeaway here that I just want to make is that you cannot overdose from casually touching or inhaling fentanyl in the air. And because remember, when I talked about what an overdose looked like, it looked like a person falling asleep. Their breathing rate slowed, their heart rate slowed. And oftentimes the symptoms that we're seeing these first responders make is more indicative of a panic attack, which can feel like a heart attack. So that's just something to keep in mind. And when we talk about touching fentanyl, there needs to be a point of entrance. If you were to touch fentanyl and then touch your eye, or put it in your mouth or touch the inside of your nose. Those are entry points, but casually touching it just from your skin's barrier, it cannot be absorbed in that way for an individual to overdose. We share this information because unfortunately, we don't want individuals choosing to not provide life-saving intervention for fear that they might overdose if they're in the same room as fentanyl or might accidentally touch fentanyl. That is not the case. That's not what we're seeing. So we like to share this information so that you feel empowered to intervene and provide somebody with naloxone in the event you witness an overdose. Really quick, just want to talk about fentanyl test strips. These are a form of inexpensive drug testing technology. They were originally developed for urinalysis, but they've been shown to be really effective at detecting the presence of fentanyl and fentanyl analogs in drug samples. So this is really helpful for somebody to test before they ingest their drug. So to use the strips, testers dissolve a small amount of that substance in water. They dip the test strip into the liquid for about 15 seconds. They are really, really sensitive, so only a small amount is needed. And then you lay the test strip on a flat surface and the results appear typically like 2 to 5 minutes. Reading these is a little tricky because they're kind of opposite of like how you read a COVID test or a pregnancy test. With fentanyl test strips, one line indicates fentanyl is present, 2 lines indicates that no fentanyl was detected. There are some limitations when it comes to fentanyl test strips. One is that they don't measure the quantity or the potency of fentanyl in that drug sample. So when fentanyl is mixed with other drugs, it's never mixed evenly. So this means that a portion of your drug may not contain fentanyl while another portion does. We refer to this as the chocolate chip cookie effect. So I want you to think of the chocolate chips as fentanyl because fentanyl likes to clump together, it likes to stick to itself. And I want you to think of the main cookie part as the other drug substance. So if I were to test a portion of the cookie that had no chocolate chips, that would lead me to believe, oh, okay, great, the sample is safe for me to use, but it wasn't mixed properly. So there is fentanyl in those other pieces. So that's when we tell people to use fentanyl test strips to really mix their substance thoroughly because of this chocolate chip cookie effect. Okay, so now moving on really to the star of today's training is naloxone. Naloxone is a life-saving medication used to reverse an opioid overdose. So it will reverse an overdose that's caused by heroin, fentanyl, or some other prescription opioid medication. And it's quickly given through as a nasal spray. I want to go over the details in upcoming slides, but you might have also heard of Narcan and wondered what the difference was between the two. Really, they're the same thing. Narcan is the FDA-approved branded naloxone nasal spray. So here's a picture of Narcan. There's the nozzle that you stick in the person's nose and the plunger. So naloxone is a one and done type of medication. You do not test it, you do not prime it. Once you press it fully, the medication has been used. It cannot be reused after that. Okay, so just to provide another representation of what's happening and how naloxone works. So recall that image earlier where the opioids were occupying all the receptors in the brain, which was leading to a breathing emergency. Naloxone has a stronger bind than opioids do to sit on those receptors. So essentially what happens, you'll see from the animation, the naloxone goes in, kicks off that opioid, and now it occupies that receptor. And it's instantaneous. The effects of naloxone are almost immediate. That's how strong its bind is. So this quickly restores normal breathing in a person who is overdosing. Now, the effects are temporary. We do see that naloxone lasts anywhere from 30 to 90 minutes. Again, it is instantaneous, but it can take up to 2 minutes for it to take effect. It is safe to administer multiple doses, so be prepared to administer second, third, fourth, however many doses you have if a person remains unresponsive. Giving them multiple doses is not going to harm them. Naloxone is also not going to be harmful if it's given to someone who wasn't suffering an overdose related to an opioid. So one of the things we like to say is, when in doubt, give naloxone. So I know I mentioned in the beginning of today's training that naloxone is only going to be effective at reversing an overdose caused by an opioid. But as we learned in previous slides, a lot of drugs are being laced with fentanyl, which is an opioid. So even if somebody was using a stimulant or a depressant and they're overdosing from that, there is the potential for that substance to be laced with fentanyl. So when in doubt, when you see an overdose happening, administer naloxone. It is not going to cause them any type of harm, even if it was another substance causing that overdose. Naloxone doesn't cause any type of dependency. It does not encourage drug use. Let me see here. I want to make sure I'm covering everything. And there are no age restrictions. So this can be given to somebody who is an infant, who is a senior. It is going to be completely safe. And I really do encourage this for people who have little ones in the home. I have a toddler at home, and like, they put everything in their mouth. So it's just something that is safe to have in the house, because you never know. It's completely safe to administer to anyone of all ages. So oftentimes individuals who are the first to witness an overdose may neglect calling 911 because there's this fear of being associated with an illegal substance. Maybe they themselves are under the influence. Maybe they have illegal substances on them. Maybe they're afraid of implicating the person who's overdosing. There's all these potential fears that could lead somebody to not intervene, to not call 911. So the California 911 Good Samaritan law was made, and it was designed to encourage individuals who witness a known or suspected drug overdose to call 911. And this law protects the overdose victim, it protects the bystander, and allows them to call for help, because it protects them from arrest, from being charged with the drugs that are on them, and from being prosecuted for low-level drug violations. So where can you get naloxone? There's a number of options, actually. One thing I want to highlight first is, in California, individuals over the age of 12 can get Narcan, naloxone, without the consent of a parent or guardian. So these resources they also apply to youth 12 or older. So one option is to obtain a prescription from a healthcare provider. I typically recommend this as the first option, because you get insurance to pay for it, right? So individuals who are at an increased risk of opioid overdose, if they have household members, if they have children, somebody in the home who is at risk for maybe accidentally ingesting an opioid, they can go to their primary care provider and request naloxone through what's called third-party prescribing. So it really just empowers an individual to be prescribed naloxone, even if they intend to use it for someone else that they are concerned about who could potentially experience an overdose. So if I were to go to my doctor and say, I have a friend who I'm concerned about their drug use, can you prescribe me naloxone so that I can use on them in the event of an emergency? Through third-party prescribing, your doctor can do that. And again, it gets paid through insurance. There is also going to a local pharmacy. So pharmacies in California are now able to provide naloxone without a prescription. We do see that it is pharmacy and pharmacist dependent, whether they carry it or not. So we really do encourage individuals to call their pharmacy before. Then there's over-the-counter naloxone. So as of July 2023, the FDA approved 2 over-the-counter naloxone nasal sprays that are available to purchase in drugstores, grocery stores, convenience stores, gas stations, and online. I think it's a little pricey. It's around $45–50 for 2 of those nasal sprays you just saw. So again, that's why I typically encourage individuals to try the first option of going to their healthcare provider. The last option is accessing a community-based naloxone access point or a mail-based program. These are nonprofit agencies throughout the county who work to provide harm reduction resources to community members, specifically individuals who are actively using drugs. So again, these are given at no cost to community members. You can find a list of those organizations on the SAPSI website. Okay, so now let's go into responding to an overdose. When you respond to an overdose, I want you to remember the 4 R's: recognize, respond, reverse, and remain. So just to recap right here, checking responsiveness, recognizing what an overdose looks like. And again, an overdose is going to be your breathing is infrequent or slowed, making the death rattle noise, skin is clammy, loss of consciousness, your heart rate has slowed, and key right here, unresponsive to stimulation. So one way you can check somebody's responsiveness is to administer what we call a sternal rub. In that image here, that is a person's sternum. If you make your hand to a fist and rub your knuckles really hard, press down firm and rub up and down the sternum, imagine somebody laying on the ground and you doing that and putting your full weight into them. It's a painful feeling. It does hurt. And if somebody is going to be responsive, trust me, they will respond to this. If they do not, then we're going to assume that that person is unresponsive. Okay, so next, if that person is unresponsive, we're going to go ahead and call 911. It's really important that we have trained medical professionals present, even if we have naloxone, because there could be other health problems that the person's experiencing. There's a chance the person could re-overdose. There's so many other factors that come into play that it makes it safer for 911 to be there. When you are making the call, you want to tell the dispatcher exactly where you are, exactly where the person who is overdosing is at. Give them as much information as possible that you could find. You know, you want to say what floor you're on. Is it the north, south, east, west building? Like, are you in the bathroom? What stall? Like, you want to be as descriptive as possible. You also want to stick to what you're observing. They're not breathing, they're turning blue, they're unconscious, they're not responsive. This makes the call a priority, especially if you label a call to a dispatcher as a breathing emergency. When the paramedics arrive, you want to tell them, you know, again, what you've observed. You don't want to tell them your suspicions. Don't say something like, oh yeah, this person does a whole bunch of drugs, they probably took this. If you haven't seen it, if you don't know for a fact, then omit that information. Just say the facts of what you've seen. And then you want to keep any type of background noise to a minimum. If it sounds chaotic, they might dispatch police to secure the scene, to protect paramedics. And if law enforcement isn't needed, it's best to just label this as emergency for EMS. This can be really triggering for somebody coming out of an overdose to see law enforcement. So if they're not needed, if your safety is not compromised, just try to keep that background noise to a minimum. And then reverse. This is where we're administering naloxone. So you saw the package it came in. You're going to peel, place, and press. So you're going to remove the device, take it out. You're going to hold the device with your thumb on the bottom of the plunger and 2 fingers on the nozzle. And then you're going to place it into the person's nostril until your fingers touch the bottom of the person's nose. You don't want to shove it up too far into their nose. As soon as your fingers hit, that's a good placement. And then fully press the plunger. Again, this is a 1-and-done medication. Do not prime it. Do not test it. Once you fully press it into the person's nostril, that is it. The medication has been used. You cannot reuse it. If a person does not respond within 2 minutes, you want to repeat this step and give the person another dose of naloxone in the opposite nostril. A lot of the time I get questions of, well, if the person's not breathing, are you sure that the naloxone is going to get into their system? The answer is yes. The skin inside of our nose is really thin, and that's where the medication gets absorbed into the bloodstream. So the person does not need to be breathing for naloxone to be effective. And then remaining with the person. So this really at this point, after you administer naloxone, two things could happen. One is the person remains unresponsive, or two, the person is awake, they respond. So let's go with scenario one first. The person is unresponsive. Again, you want to make sure you're administering that second dose of naloxone. And you want to make sure that advanced medical care is on the way. If for some reason you need to leave the scene, you want to make sure that you put the person in what's called the recovery position. This is going to keep their airway clear and open, especially if that person vomits any fluid. They're not going to choke on that vomit. We often get questions about, rescue breathing, about providing CPR. If you are certified and trained to do so, you would want to begin administering rescue breaths. Not necessarily CPR. CPR, remember, is something you would do because that person's heart has stopped. During an overdose, it's a breathing emergency. We typically still feel that person's heartbeat going. But I don't want to get into too much detail because, again, this isn't CPR or rescue breathing training. I do encourage the individuals who are interested to seek out that training. But again, making sure if you need to step away, whether it's to call or direct EMS to you, you are putting this person in the recovery position. Okay, so scenario number two is that person is responsive. If this happens, congratulations, you've successfully reversed an overdose. But now what? Here are some things that you should expect. One is opioid withdrawal. So after giving somebody naloxone, they might want to use again right away. And the reason that is that they're trying to counter the symptoms of opioid withdrawal. So keep in mind, naloxone reverses the good and the bad effects of an opioid. So while that person's alive, they're able to breathe, they're also experiencing withdrawal symptoms from not having that drug in their system and for the opioids being knocked off those receptors so fast. And these symptoms can include headaches, they have a rapid heart rate, they're sweating, they feel nauseous or vomiting, they have tremors. Really, they just feel extremely uncomfortable, but it's not typically life-threatening. So really the risk of death for someone overdosing on an opioid is worse than the risk of them experiencing these withdrawal symptoms. Next is the risk for re-overdose. So individuals coming out of an overdose, there is a possibility of re-overdosing. So remember I said naloxone lasts 30 to 90 minutes in a person's system. Well, what could happen is the naloxone could wear off. And if a person ingested or took enough of an opioid, there can still be opioids floating around in their brain. And if the naloxone wears off, those opioids can reattach on those receptors, again, leading that person to overdose. So this is why it's so, so important that we stay with that individual until help arrives. This is why it's so important that we make sure EMS or advanced medical care is there. And so what can you expect from somebody who's coming out of an overdose? Unfortunately, there's this misconception that people come out of an overdose as really aggressive, as combative, and really this isn't true. What we're seeing is that they're disoriented, they're terrified, they've just gone through something that's extremely traumatizing, and often what we're seeing is fear, confusion, and then on top of it, they're not feeling well. So this is how you would want to respond. One is you want to make sure that you're giving that individual space. You want to calmly explain what's happened, the level of care that you've provided them, and you want to encourage them to take deep breaths. This is not the time for the individual to start hyperventilating, so you want to help them control their breathing rate, and you want to support them. You may say something like, "Hi, so-and-so, my name is Lisette. I saw you weren't breathing. I think you were overdosing. I had to give you some naloxone. I'm so sorry you don't feel good. Sit up when you're ready. I'm here and you're safe." And then from this point on, you're just going to continue to stay with that individual and support them. So what not to do when responding to an overdose? So I want to talk about some common misconceptions that you should avoid doing when responding to an overdose. One is don't slap or forcefully try to stimulate that person. It could cause further injury. So if you can't wake the person by shouting their name, shaking their shoulder, administering a sternal rub, that person is unconscious. There's nothing else you need to do to prove that at that point. Don't put the person in a cold bath or shower. This could increase the risk of them falling, drowning, or going into shock. You also don't want to inject them with any type of substance. You don't want to inject them with salt water, milk, stimulants. These are kind of common ones we've heard. The only safe and appropriate treatment at this point is naloxone. You also don't want to make that person vomit any drugs that they've swallowed. This can lead to them choking or inhaling vomit into their lungs, and that can increase the chance of a fatal injury. And then you don't want to give them anything to eat or drink. This also puts the person at risk for choking. And this also includes the person coming out of an overdose. Right away, you don't want to offer them water or something sugary to drink. Just encourage deep breathing. Because again, if they re-overdose and you're in the middle of giving them water, that gives them the chance for inhaling that liquid into their lungs. So at that point, you're just encouraging breathing. You're just providing support for them. This training video was given by Emergent Biosolutions. I'm not going to go play it right now because I know we are a little pressed for time, but I will be sharing these slides. This just goes over everything on how to respond to an overdose. Really quickly, I want to talk about resources in LA County. So youth, young adults, and adults can access at no cost substance use treatment services at any provider in the network if they meet the following criteria and medical necessities. So one is they have to be in LA County plus one of the following options. They need to be either Medi-Cal eligible or enrolled, or My Health LA eligible or enrolled, or be part of another county funded program. This number, I really encourage all individuals to write down. This is the Substance Abuse Service Helpline, also known as the SASH helpline. It is toll-free, available 24/7, year-round. There are interpretation services available. Anyone can call the SASH hotline, including youth who are 12 years or older. They will be connected with a clinician or counselor who will conduct a brief screening and connect them to a treatment provider. The SASH operator will connect them with a treatment provider or provide them with other referral options. So this is a great resource that we see a lot of our agencies in the county use as well. Another resource I highly recommend is the Recover LA mobile app. This is a free mobile app. This provides education, resources for those seeking substance use services for themselves or others. It's available in 13 languages. You can scan the QR code to download the app. But again, this is really helpful if you're interested in finding out where to access naloxone, where to get fentanyl test strips, how to find treatment services. This will provide you with all available resources in LA County. And if you need to find additional support, here are some other ones listed. There's the 988 Suicide and Crisis Lifeline. We have information from DMH Access Hotline, information for accessing services provided by Department of Social Services, and then of course the Substance Abuse and Mental Health Services Administration National Hotline. Okay, so I think we have enough time to answer any questions that anyone might have, but I'll go ahead and end it here. There's our harm reduction unit email if you have any questions or need to reach out to our unit.
So Lizette, we did have a question. Thank you for the great presentation. What is the shelf life of naloxone? In other words, if this person was to get it from their pharmacy, do you know how long it would be able to be stored before it was expired?
Yes, so the shelf life is 3 to 4 years. However, there have been studies done to test how effective naloxone is even after past its expiration date. And it's been shown to still be effective even 2 years after it's been expired. So one thing we like to tell individuals is that some naloxone is better than no naloxone. So even if you have a unit that has been expired and that's all you have with you, administer it because it could be life-saving for that individual.
Okay, great. Thank you for that. If there are any additional questions out there, please go ahead and chat or use the Q&A. I do see. Okay. How effective is one nasal dosage, or is it typically to need to give more than one dosage?
It depends how much the individual, how much opioids the individual took. It is highly effective. And we do see that if somebody is overdosing from an opioid, it should be effective almost immediately. It could take up to 2 minutes for the naloxone to take effect. We oftentimes see that multiple doses might be needed. It just depends on how much that person took.
All right, thank you for that. I will just add a little personal testimony. A family member of mine had a knee replacement and came home with a prescription for an opioid, and I found her unresponsive. She was breathing and couldn't wake her, just like you had said. And so I did call 911 and got her the help that she needed, and she was fine. But that was pretty much the scariest thing I've ever had to deal with in my personal life. Watching a family member of mine not be able to wake them. So that was super scary.
Oh, absolutely. I'm so sorry that you experienced that, Laura. And
It happens.
yeah, it happens. And that's what, I really encourage people to think of naloxone the way you would of having a first aid kit in the home or having like a fire extinguisher in the home. You never know when you need it, and you don't want to be in a situation where you need it and you don't have it. So it is so widely available. I really do encourage individuals to just have it. Just have it as part of your first aid kit in the event of emergency, because you never know.
Yeah. Here's a couple more questions.
Mhm.
Does the person's weight affect the dose given?
Not that I know of, no. Again, it is dependent on the type of substance an individual has taken. Um, so again, if a person is not overdosing from an opioid, it's not going to be effective. But depending on how much opioids that individual is taking, they might need multiple doses.
Okay, another question is, can you get the medication anywhere?
It is now available over the counter as of July of last year. So you can purchase it at like your local CVS, Rite Aid, Walgreens. They should be available there. Again, I do think it's a little pricey, so that's why I do encourage people to go through their doctor to get it. That way it's prescribed to them. That way their insurance covers it. It is Medicare and Medi-Cal covered. So this is why I really encourage individuals to go through that route, but it is widely available.
And another question, if we do get the prescription from our PCP, do they only prescribe one naloxone? So would it be a package with just one, or one package that contained two, or how does that work?
Yeah, so it depends on your insurance coverage. Typically, we see that a box of naloxone is given, and in that box comes 2 nasal sprays, so 2 doses.
All right, thank you for that.
Mhm.
Any other questions? Please don't be shy. This is both a fascinating subject as well as super scary
Yeah, absolutely.
subject as well, but really important, especially like you had mentioned, if you have, young people in your home, or if you're caring for an older adult, or just somebody who may have received this type of a medication from their physician or otherwise, to be able to save a person's life potentially, or
Yeah, and
a student, or
absolutely.
somebody in a youth group.
Yeah. And actually it's state law now that if you are ever prescribed an opioid from your doctor, they are required to also prescribe you naloxone. So as a harm reduction best practice measure. So if you're ever prescribed an opioid, just make sure you're asking and following up, making sure that you receive naloxone as well.
Now that's really interesting because I live in Colorado
Oh.
and my son just had his wisdom teeth removed and we were prescribed oxycodone,
Oh,
you know,
wow.
to use if for breakout pain. So I don't know, I can't remember if you said that was just a California thing or not.
Yeah, I think it's a state law. I don't know. I don't think every state implements that.
Okay, thank you.
Yeah.
We have some additional questions. Um, just an FYI, not really a question, just sort of a helpful tip for those on the line. Many CVS pharmacies will write a prescription on what on site to have naloxone covered by your insurance. So no physician appointment is needed. So thank you very much for that. Another comment here, some high schools provide it to students
Mhm.
that she said or this person said, my daughter's school had a safety day and fentanyl test strips and Narcan was available for students to take. Wow, that is fascinating.
That is so great. We're trying to do that within LA County. Unfortunately, there's some pushback, but I do encourage, all youth to have access to this as well.
An additional question and comment is, I have a student who is addicted to Xanax and lately he had an overdose issue to it, the the pills being laced with fentanyl. Can
Mhm.
you elaborate if the use of Narcan would be useful?
It would, but remember, they would be unable to administer naloxone to themselves. So one of the harm reduction methods we tell individuals who are actively using is to never use alone. And there are a lot of resources out there for them to make sure that somebody responds to them in that event. There's actually a national hotline, and it's the Never Use Alone hotline. The number is, let me find it really quick. The number is, gosh, I want to make sure I get this slide. 877-696-1996. Individuals can call that number and they will be put on the line with a representative who will ask what their overdose response emergency plan is. It's completely anonymous. You can give them your address and say, call 911 if I stop responding. Send, emergency services to this address. They don't ask for age, they don't ask for name. So it's really a great resource if you know somebody who is actively using to at least not use alone. And if they don't have somebody that they can trust that they can, administer naloxone in that moment, at least they can use this hotline.
Okay, great. Yeah, if you would include that in the information that you sent over to me, I will be happy to include it in the follow-up email.
Absolutely.
And we're just about out of time, just a couple of minutes, one more minute to go. If anybody has any last questions or comments, I would say thank you again for joining us. This is Laura Maloof Miller, and I will be sending out the slides as well as the additional resource she just talked about and the recording link in about a day or two. And I'll be sending that to everybody who registered, regardless if they could attend today. Looks like we've got one last question here. Is there anything we should be doing while we wait for the 2 minutes for the naloxone to work?
Yeah, so if you're trained, at this point, you can be giving that person rescue breaths. That would be appropriate to do at that time. If you're not trained, you would just want to make sure that this person is either in the recovery position, uh, um, or again, that you're giving rescue breaths. So those are really the two options.
Okay, great. Well, we are out of time. Again, thank you everybody for joining us. Please feel free to exit the webinar at this time.
Great. Thank you, everybody.
Thank you, Lizette.